Thank you. Thank you, Dr. Sarab. Thank you for taking over in the very crunch time. Artificial intelligence, machine learning, and deep learning in medical imaging. So in 1895, a man from Germany, took an image of a hand. And that image was so amazing that he won the Nobel Prize. And this is what the image was. This was the first ever X-ray that was done in the world. And this might seem like a very bad quality image if you look at it from 2020 standards. But at that time, the significance was really high because that was the first time you could look inside a human body without cutting it up, right? And 120 years, 25 years later, medical imaging is still one of the most, I would say, highly generated data in the field of medical science. So the gentleman's name was William Röntgen, and he basically set the cornerstone of what medical imaging is today. So what the thought was and how it's evolved before we actually sort of move on into what we're doing, the thought was that medical imaging is going to give insights that normal clinical data won't. It will give you access to information or access to patterns, and it will help you in being able to detect disease before it actually occurs. That was the thought back then as well. You know, we talk about AI now, we talk about ML now, and we talk about doing predictions now. But this is actually what was the thought back then as well. Will there be patterns? Will we be able to detect disease? Will we be able to decide whether we need to give a person some sort of medical treatment or not? Or does a person need medical treatment or not? And you can probably imagine, I mean, if I can see by a show of hands, how many of you have had some sort of medical imaging done, whether it's an X-ray or an MRI or a CAT scan? I mean, there you go. I mean, at an average, I think one person has about at least 7 to 8 or 10 such medical images. But what happened with time was that the volume of data started to increase, and it became more and more difficult for doctors and for medical centers to be able to accurately predict what is actually going to happen. So, but what has also changed in the last 120 years is that computation has also increased, and the power of compute has also increased 1,000-fold, right? Artificial intelligence, you'd be surprised. When do you think autopilots were invented? The autopilot that can take over the flight of an airplane when it's in full altitude. When do you think? Wild guess, how many years ago? 1820? What? 80. It was in 1914. It's over 100 years ago. All right, so that is a very basic form of artificial intelligence, and it was there like over 100 years ago, right? And it was actually tested on very basic level flights, but it was around. It has been around for a very long time. So artificial intelligence is just making a computer mimic human behavior, right? And basic microcontrollers have been doing that for a very long time. Deciding whether the door should open for someone or should not open for someone, something should happen at a particular time, something should not happen at a particular time. This is just computers mimicking human intelligence. Then came machine learning. This is actually what started happening in the late 90s and the early 2000s, that we were then actually able to retrain a computer or retrain an algorithm by giving it continuous streams of data, and eventually then that evolved into deep learning, and subset of them. That's a smaller subset, but then so I won't get into the technicalities. Before I get on to the next slide, I'll just quickly introduce Integration Experts. We are a group of engineers, data scientists that have been working in this area for a very, very long time and have been particularly working in imaging and AI in imaging. And we always wanted to do something in the healthcare side. We approached knocked on quite a few doors, and eventually we came to AKUH, and we were led to a team of two amazing doctors, one of them who you heard just before the break, Dr. Zara and Dr. Babar. And we were like, we have a lot of talent here. The problems in this part of the world are tenfold and very different. Like again, Dr. Zara said, so I'm taking a few words from her presentation. Unique set of challenges Pakistan has. We have cities that have population the size of countries. More actually. Karachi is probably 5 times the population of some very, Finland, for example. Finland is 5.5 million people. Karachi is, at least on paper, it's 25 million, and I'm sure unofficially it's a lot more. So the challenges that are posed in this part of the world are much greater. And we eventually then met with Dr. Babar and Dr. Zara, and we said, let's try and work and see where we can work in this area in Pakistan. So I could not have continued without mentioning these people. I've been unfair. So Dr. Babar, Dr. Zara, and then these 3 people are some very smart people from my team at Integration Experts, and these are the people who are driving this from our end. So we sat down, put our heads together. Look, AI. Let me set this straight. We can have the best data scientists in the world, but we're nothing without domain knowledge. We can't do anything. We can have the best techies in the world. I can have the best programmers from the best universities, but if I don't have domain knowledge, AI is not getting anywhere. Okay, and there are very few people who are actually willing to impart that domain knowledge for the betterment of society. So we sort of, thalassemia, as you know, and I'm going to cover a few glimpses in that in my slides as well. Thalassemia is a major problem in Pakistan. My stats are a bit outdated. Dr. Zara said 8,000 children are diagnosed with thalassemia every year. I had 5,000 as a number. Even I thought even that was high. But 8,000 is a huge number. And I don't know if you know anybody who has been through this. I do. And just watching them is, seeing them go through this is a very painful experience in its own. So we sat out, we said, and the challenges, what are the challenges right now? That there are a lot of imaging centers, but to be able to actually read that MRI, you need to have a very trained physician, and you need to have very specialized machines. So we said, all right, let's try and take tech and sort of scale it. And let's try and develop a system or an algorithm which can estimate T2 star value for detecting iron overload in thalassemia patients. So the idea is that it's still happening, obviously, but the time from getting that image to the actual diagnosis is something that we are aiming to reduce. Thalassemia numbers. Sad numbers, 5,000, 8,000 every year. These are some of the age groups that are affected by it. It is preventable, but there are a lot of taboos around that in Pakistan about pre-marriage testing. But whatever it is, this is where we are right now. So we then got back to the drawing board. We said, okay, let's divide this process into 4 clear stages. First one, classification, simple classification. So let's build a simple algorithm. Now, bear in mind, what we're trying to do is we're trying to take the tech to the edge rather than having it converge to a center. We're taking it to the edge. There's a term that we use in technology, especially when it comes to AI, is democratizing technology. So democracy achhi bhi hoti hai. Democracy in Pakistan is actually sort of looked at in different ways, but what we are trying to do is we're trying to take tech to the common man. Stage 2, there are some sequences that a doctor would use and a doctor would not use. So what we're doing here is we are trying to transfer that knowledge, that expert knowledge, the domain knowledge of doctors, and we're trying to train an algorithm to do the same. Obviously, you must be thinking how we're doing that. We needed data. We got access to anonymized data from AKU again. And the third stage was actually looking at and picking out the area of interest, which was by segmenting the heart and septum. And then the stage 4, which is the actual output of any AI algorithm, is to basically figure out or determine or predict a certain value, which in this case was a T2 star value given the sequence. Without getting into what I did was I sort of described the stages, but I'll quickly run through them. Pre-processing, there's a bit of pre-processing involved, and I'll save the details because the idea is not to get all tech about this, but these are some of the images. So what we needed to do was we needed to do a bit of enhancement as well. Now, the computer, when we start building an algorithm, is dumb, right? It's just a lot of compute, it's just a lot of neurons which don't know what to do. And to be able to train it what to do, you need to start, so computer जो है ना वो एक ही दुकान समझता है, वो signal processing समझता है, ठीक है? It just understands signals. It doesn't know what a heart is, it doesn't know what a septum is, उसको सिर्फ signals समझ आते हैं. And the reason that you've seen this, sort of increase in AI lately is because of the ability of the computer to compute at really fast rates, and the type of computes that you can see. What you have in your hands right now, a mobile phone, is 10 years ago what would not exist on a laptop, and 20 years ago, or 30 years ago, would be probably on a mainframe. So the computes have definitely increased. So pre-processing was one of the first stages. Then eventually what we had to do was we had to tell it a good sequence from a bad sequence, a blurred sequence from a non-blurred sequence. And then obviously, again, and this is a constant process of tech and domain knowledge. So our team and AKU's team constantly sort of, we go back to the drawing board, we refine the algorithm, we come back, we get more input, and probably I'll become a doctor one day just by going through these sessions. So again, the area of interest, to be able to figure out what the actual septum is, to be able to figure out the area of interest, this is where we have sort of gone so far. And eventually the goal is module 4, which will be to estimate the T2 star value. So what is actually happening? Try to understand. What happens now, you get an MRI done, and you have to wait a very long time to bring that MRI to a specialized medical care center to be able to decide what kind of medication you have to give. So what are you doing? You are, the amount of time that the patient has to wait, that's a lot of time, and it's very valuable time. What you're doing to the actual doctor is that you're overloading them with cases which they don't need to see. Okay? So they may not need to see 7 of the 10 patients that they saw that day because they could have been screened, before actually coming to the doctor as people who are not at very high risk. And so the 3 are actually at very high risk because there could have been prioritization. So what we're trying to do again, and I'll keep saying this, is we're trying to take tech to the edge. We're trying to give them instant classification and instant prediction, and eventually, with time, we're trying to make this algorithm smarter and smarter because of ML and DL, that it will be able to screen patients into immediate care required or follow-up after 1 month. This in itself is going to create, and I mentioned Pakistan's population and I mentioned the population challenges in this part of the world. You have no idea how much difference this is going to make in a place like Pakistan. And how much, so Mesum said when he was introducing me before the power outage that radiologists need to be concerned. No, I don't think you need to be concerned. I think that radiology again and imaging again is right at the center of medical enhancement and the future of medicine. There are some other examples as well of what's happening in the world. Oral cancer. It's a huge problem in this part of the world because of tobacco intake. Men, women, kids, all age groups, right? And in most cases, 90% plus, the time that they find out that they have oral cancer, it's usually a downhill journey. It's usually too late. But there are studies that suggest that there is a possibility to detect this up to 2 years in advance. Now imagine 2 hours in medical language, in medical terms, could be the difference between life and death. Even 2 minutes can be the difference between life and death. Imagine getting to know 2 years earlier. So you must be thinking that what does the computer see which the human eye doesn't see? Before I answer that, another very interesting study that has happened in the world is 1 in 10 people are eventually going to develop something called osteoarthritis, if I pronounce that right. And that is a condition of the cartilage falling off between the 2 bones in your knee joint and the bones rubbing against each other. Osteoarthritis. Okay, that. Okay, so that knee condition. I'll just put it that way. So at the top you see these are all different subjects, and these are also all different subjects. These are MRIs that are done 3 years in advance of all these subjects. These people developed did not. Now, why weren't doctors able to see a pattern? Is it because they're not qualified, or is it because they're not smart? And why was a computer able to detect with 86% accuracy as to who is actually going to get this condition in the next 3 years? And the answer lies in 2 things. A, when a human looks at something, there's always a certain bias. That's what makes us humans, right? And when a computer looks at something, there's absolutely no bias. It's just looking at signals. The other thing is that the amount of legwork that a computer can do without any external elements affecting it is way, way more than what a human can do, right? And which is why these algorithms have been able to figure out that water deposits at different parts in the cartilage eventually will form near the cartilage in 2 to 3 years' time. And imagine 2 to 3 years' time. So what has started to happen now is that at certain age groups, your physician will probably tell you to get some sort of a scan done, right? So you're approaching 40, or based on some other data, you play certain sports, you're 35, please get an MRI done. And that then will go through these algorithms and will help you in advance to either change your lifestyle or start medication now to prevent that disease from happening 3 years later. So I'll just break it down for you, I'll just, and I sometimes have to break it down for myself as well, I have much smarter people in my team, and I think, so I have to have them break it down for me as well. What is machine learning? There are only 2 sources of knowledge in the world, right? I'm sort of, going against the quote of Albert Einstein, which is there's only 1 source of knowledge, but I wanted to play safe. One is revealed knowledge, which we won't talk about, and the other is knowledge by experience. So what are we doing? We're just fast-tracking that experience into a machine learning algorithm. We say, okay, we will give tons of scans to the computer, and we will put in the reports, and we'll give that against each scan to the computer as well. Okay, so thousands or hundreds of scans, and reports against those scans as to what level of iron overload was there, or what level of cells were there in the mouth that can lead to mouth cancer. And then the computer starts to churn all that data. You know, that's where the might of compute comes in. And it just keeps on churning day in, day out. You just give it 5 volts into the motherboard, and it's amazing what those 5 volts can do. It's just churning day in, day out. And then you give it some classification rules. That if you get, so based on what it ingested, you give it some rules, right? So if you get an image which looks like this is how you're going to classify it. You know, so again, and what it then actually gives you out is predictive output. And I would just like to reiterate that garbage in, garbage out is something we're all familiar with, and Dr. Zara also mentioned that. The quality of data and whatever algorithms that we build, again, are no use without properly labeled data, and this is one of the biggest challenges we have right now, right? You know, building algorithms is not the real challenge. I say that, and people, you know, look at me, especially people from the computer science industry, look at me in very, you know, weird, with very weird looks that, you know, you're undermining our work. But that is true. Ultimately, you know, this is the fuel. The data is the fuel that drives AI. Threat or opportunity? A lot of people think that AI is going to drive these, radiologists' work out. Absolutely not. Definitely not in Pakistan. If anything, it is actually going to increase the quality of care. And you know, the more the images you see, the more the images and the more examinations you report, the better you get, and that's the same with M-Health. And what you're actually doing is you're helping reducing the work of a radiologist by helping them sift out all data that does not need to be seen. So what are we trying to do? Apart from a early screening, which is what we discussed, what we're trying to do is, we are trying to, this is how things look like currently, right? You get data, you get images, you get from various places, from the edge, and they all converge to one central location. This is what we're trying to do, okay? And this is what AI eventually will achieve. Is we are trying to bring a certain screening process called AI in the middle, which will then limit the people that actually end up going to a medical facility, and hence increase the quality of healthcare. That's about it. I did mention integration experts in the beginning. Thank you. Okay, so I would like to thank Dr.